Assalamualaikum warahmatullahi wabarakatuh. Bismillahirrahmanirrahim. I am Dr. Syed Abdul Khalik Syed Abdul Hamid. I'm a neonatologist and a pediatrician. So basically, this morning I want to speak specifically to my medical students, as I am a clinical lecturer, and also to all the junior doctors out there. Senior doctors, no, you don't need this knowledge anymore. You should know this already. So basically, I'm going to talk about the four objectives of the job that we do, the four objectives of when you clerk patient and you get history, and when you do physical examination, and when you do case presentation, especially for medical students, when you present cases for long case presentation in your exam, in teachings, and so on and so forth. So there are four objectives that you do need to cover, you do need to speak well, and you need to actually make sure that these four objectives are fulfilled. So what is the first objective? So the first objective is actually to get to your provisional diagnosis, to get to your provisional diagnosis, to focus, to zoom in on your provisional diagnosis, because we treat patients will be based on what is the provisional diagnosis. The prognostication, the discussion, the management, the immediate management, all will depend on the provisional diagnosis. So your history should be complete enough, should be thorough enough to actually get you to know what is the provisional diagnosis in depth. So you need to know, you need to get to your provisional diagnosis from your history, from your physical examination, and when you then present the case for case presentation, during rounds, and so on and so forth. So your history, your presentation should actually reach to your provisional diagnosis. Those who listens to you should actually understand that this is where you are trying to guide us. This is where you are trying to go, which is your provisional diagnosis. That's the first objective. The second objective is actually to rule out differential diagnosis. I always tell medical students, you need to have at least 5 differential diagnoses. You need to have at least 5 differential diagnoses, because again, when we treat patient, we do not just treat that one particular disease. We need to think as a whole, because sometimes when we clerk patient initially at around 2 a.m., 3 a.m., sometimes we won't be able to get complete history. Sometimes parents may forget things, and then when more people clerk the patient, more people ask questions, so parents may have more time to actually clarify certain parts of history. They may remember additional information. They have time to clarify with other patients. They may have time to clarify with the other parents, the siblings, and so on and so forth. So sometimes you may get more information. So without you thinking of other differential diagnoses, you may not get full thorough history. And I always tell people as well, if you do not know what is your differential diagnosis, you may never ask appropriate questions. Because again, it is ideal in medical setting for you to ask open-ended question. Sakit apa hari ni? Rasa macam mana? But with just those type of questions, yes, it's good, but you may not get enough information. So sometimes you do need to have more open targeted questions. For example, batuk macam mana? Cuba ceritakan batuk tu macam mana. Ataupun like batuk tu bunyi dia macam mana? Batuk tu ada bunyi macam kong macam tu ke? Ataupun batuk tu sambung and then ada bunyi macam tu. So what type of sound? So sometimes you do need to ask some open targeted question, and sometimes you do need to ask a closed type of question. Macam ada batuk, ada sawan, ada pergerakan macam ni. So sometimes you do need to ask close-ended questions as well, whose answers are yes and no. So open-ended questions is good. You do need some open targeted questions, and sometimes you do need to have your close-ended question. My point is, you can never ask enough appropriate questions without you knowing what are the differential diagnoses. So again, the first objective is to get to your provisional diagnosis. Second objective is to rule out differential diagnosis, at least 5 differential diagnoses. So your history should have all the information. What are the pros, what are the positive, and what are the negatives of each differential diagnosis in depth. So you need to have at least 5 differential diagnoses. So the third objective is to look for complications of the disease, because all disease has complication. Nothing in this world do not have any complication. So you do need to look for those complication. If your provisional diagnosis is asthma has complication. If your provisional diagnosis is AGE has complication. AGE, acute gastroenteritis, has complication. The child may present with severe dehydration, may go into shock, and so on and so forth. So you do need to go through all those complications. Your history should look for the complication of the disease. Your physical examination should look for the complications of the disease. And when you present the case, you need to make sure that you have shown to your listener that you have looked for all those complications of the disease. So that is the third objective. The fourth objective is actually to look for the complications of treatment, complications of the management, because everything that you do has complication. Nothing that you do not have any type of complication. So everything that you do may have its own complication. You minum air kosong pun ada complication. Nothing in this world tak ada complication. Anything you do has its own complication. The child may present to the hospital at day 5 of illness, for example. The past 5 days, the child is unwell at home. The mom may have sought treatment from GPs, and GPs may have started some type of treatment, and those treatment has complication. Antibiotic has complication. Salbutamol has complication. Nothing in this world do not have any complication. And the past 5 days, mother may have even brought the child to traditional healer and so on and so forth, and all this has its own complication. And then the mother may not have done anything. Not doing anything also have complication. If a child presents with febrile seizure, for example, and when the child had seizure, parents don't do anything. They are so panicked. They don't do anything. Not doing anything has complication. So management, doing anything has complication. Not doing anything also has complication. Not just that, you need to remember, the child before coming into your ward may have, obviously will go through ED, emergency department, and in ED some sort of treatment may have been done. IV line may have been set. IV line has complication. Some sort of medication, some sort of treatment may have been initiated, and all those has complication. And if you clerk the patient at day 3, day 4, day 5, day 10 of admission, many things has been done in the ward throughout the admission, and all this thing has its own complication. So your history, your physical examination, and when you present the case, it should look for all those complications of the management. Okay, all right. So again, 4 objectives. The first one is to get to your provisional diagnosis. Second is to rule out differential diagnosis, at least 5. Third is to look for complications of the disease. And fourth is to look for complications of the treatment. Okay, all right.